Local programming on KRWG Public Media made possible in part by viewers like you. Thank you. Welcome to Issues and Answers, New Mexico Healthcare. I'm Fred Martino. Thanks to the Affordable Care Act, fewer New Mexicans are uninsured. One reason? The state expanded Medicaid under the ACA. Texas refused to do so and has the largest number of uninsured residents in the country. Nearly 5 million people, about 1 out of every 5 Texans under 65, is without health insurance. It's a very different environment here in New Mexico, where there are 2 ideas to further expand coverage before the state legislature. One is a proposal for universal coverage through a state plan. We'll talk about that coming up. The other idea before legislators would allow people to buy into the state's Medicaid plan. It's a proposal that has been endorsed by the city of Las Cruces, Doña Ana County, and many other municipalities across the state. In depth, here's Michael Hernandez.
Doña Ana County joins Bernalillo and McKinley counties, the Albuquerque City Council, and a handful of other municipalities in New Mexico that have already adopted Medicaid buy-in resolutions this year. The federally supported program provides health coverage to low-income residents. Organizers from the New Mexico Together for Healthcare campaign, a statewide coalition of families and organizations, presented the resolution to the county's Board of Commissioners at a recent meeting. Abuco Estrada, supervising attorney at the New Mexico Center on Law and Poverty in Albuquerque, says the group is looking to expand Medicaid access to roughly 180,000 New Mexicans without health insurance.
No family should go without health care because they can't afford it. And so what the Medicaid buy-in would do is it would leverage the Medicaid program to offer a plan through the state that people can buy into that's more affordable than private options that are currently available on the marketplace.
State lawmakers passed a memorial during the 2018 legislative session exploring the policy and financial impacts of offering New Mexicans a Medicaid buy-in plan. Nearly 830,000 New Mexicans received Medicaid benefits in September, according to the state's Human Services Department. Estrada says among New Mexico's uninsured residents, about 25,000 live in Doña Ana County.
These include individuals who just can't afford coverage through issues with employer coverage rules under the Affordable Care Act, issues around just being low income and not being able to pay co-pays, deductibles, or maybe even the monthly premiums themselves, as well as individuals who are undocumented and may not have access to care because they're completely locked out of the healthcare system, be it Medicaid or marketplace coverage.
Campaign member and former District 2 County Commissioner David Garcia says between his mother and neighbor, he understands the local need for health care access.
My mother is 89 years old, almost 90, and I know what trials and tribulations she goes with health issues. But I have a neighbor that is about a block away from me, has no running water, lives in a little mobile home, and the other day he had run out of oxygen, and he has no medical coverage insurance. And I say, how could we do better and promote something like Strong Families is doing in promoting something of buy-in for insurance?
District 2 County Commissioner Ramon Gonzalez presented the commission board with details of the resolution before the county passed the proposal. Gonzalez says now it's up to state legislators to draft a bill that will cover people without health care in lower income districts like his.
In my area, we get a lot of poverty, which it comes from Anthony to Chaparral, to Chamberino, to Lañon, Sunland Park, and Anapra, in which I've seen a lot of my constituents unable to go to the doctors because the thing is, they don't have no type of insurance. And that was my concern, is to get my constituents some type of coverage that they will need so they can move forward in their lives. And that's what got me interested in this.
Estrada says one of the main barriers to individuals getting coverage under the Affordable Care Act has been affordability. Healthcare was also a key talking point for politicians during the 2018 midterm elections.
In fact, you saw with the most recent election in a poll that was done that 77% of New Mexicans said that affordability of co-pays, premiums, and deductibles were a huge issue for them in voting in the elections. And so the Medicaid buy-in plan is an innovative solution that can address that and provide quality, affordable health care to every New Mexican.
Outgoing Governor Susana Martinez expanded Medicaid in New Mexico under the Affordable Care Act in 2013. Since then, the uninsured rate in New Mexico has dropped by more than half, from 382,000 people in 2013 to 187,000 in 2017, according to the U.S. Census Bureau. For KRWG Public Media, I'm Michael Hernandez.
Doña Ana County, just one of many municipalities that have endorsed a Medicaid buy-in plan before the state legislature. In partnership with the League of Women Voters of Greater Las Cruces, we'll be talking about health care over the next hour. From the League, we welcome Vicki Simons. Davina Norris is here from the Health Security for New Mexicans campaign. And to talk about the Medicaid buy-in plan, Colin Bayo of Health Action, New Mexico. Thank you all for being with us today.
Thank you for having us.
It's great to have you here. Vicki, I want to start with you. Let's talk about some of the issues that the League has been talking about in relation to health care.
Okay. The National League has been involved in talks of health reform and health policy for 30 years. And they did a national study which was 2 years long in the early 90s, and evolved our position on health care. And basically what the League cares about is that we believe that a basic level of quality care at an affordable price for all U.S. residents with strong control measures. And our position calls for a national health care plan supported by general taxation or single payer. With regard to the administration, we support a combination of public and private sectors or a combination of federal, state, and local agencies. After the national attempt at national health care reform in the early 90s, the failure of it, the League came to believe that perhaps the most innovative place for healthcare reform would be at the states. It turns out the states, over our history, have always been the centers of innovation and policy. So the League is very much in favor of state healthcare reform on the state level, spreading hopefully to the national level. For instance, in Canada, Saskatchewan was the first province that adopted the single payer plan, and it spread to the larger provinces in the whole nation eventually. So our local league did a study of healthcare about 6 or 7 years ago, and we came to our state position. And our state position supports both the Health Security Act and Medicaid buy-in. Medicaid buy-in for an interim solution and for a long-term solution, health security or universal health care.
And we're going to be talking about both of those ideas with our guests today. Quickly though, I want to mention something in relation to the League's position on this, not only in our area and in the state, but nationally. You noted that there is support by the League for what's called single-payer health care. Canada, as you mentioned, is one example of that, where, like in the U.S., you have private providers, but payment for health care comes from general taxation from the government. And I want to touch on this briefly because there have been a lot of polls on this of the American public in the last couple of years, and there is very wide support for this idea, and many people do not realize this. So I want to look at one poll from the Kaiser Family Foundation. You hear about Kaiser a lot because they do a lot of work on health care. And last year, when they surveyed the American public about Medicare for All, which is, of course, Bernie Sanders' plan for single-payer health care, a majority of the American public favored this idea, 59%. Only 38% opposed it, so a little more than a third opposed it. Something very interesting as well, though, when the question was phrased to ask people, would you support Medicare for All as an option? You may remember the idea of an option came up when we talked about the Affordable Care Act under President Obama. And due to a lot of lobbying, there was no option for a public plan. It was shot down very early in the game. When you ask people in relation to Medicare for All as an option, this would allow folks to keep private insurance of some kind if they wanted to. 3/4 of the American public, 75% of people favor the idea, only 20% oppose. This gets to really the nature of our system that we have right now, I think a lot of people would argue, which is not serving the nation well as far as when Americans are polled on this. And that's because it covers fewer people, because it's not a universal system. The outcomes, the health outcomes, are much worse than countries that do have universal health care, like Canada. And of course, the final thing is it's much, much more expensive to have a system like we do now, which might more accurately be called a healthcare industry, not a healthcare system. Davina, this brings us to you and to talk about what is being done in New Mexico, because you have, before the legislature, a plan to have a single-payer plan in the state of New Mexico. Tell us about that.
Awesome. Yeah, thank you, and thank you for having me here today. And I appreciate those statistics that you just shared, because when we ask why we are here, you summarized it very well. If we look at the big picture, the United States spends by far the most per capita on healthcare. We have worse outcomes and we don't cover everybody. So clearly we need to evaluate ways to do something differently. So the New Mexico Health Security Campaign is something that has actually been in the works for over 2 decades, believe it or not. There's actually many people in our community that have been involved with this effort for many years, and I commend them. The New Mexico Health Security Act would allow New Mexico to set up its own health plan to ensure that all New Mexicans have coverage. The majority of New Mexicans would be included, automatically enrolled in this plan, with a few exceptions. Some of those exceptions include federal retirees, active military retirees, and that's because if they were to move out of state, they could lose their federal protections for those. And there are other groups that could opt into the plan, such as our tribes and pueblos, the sovereign nations, they can opt in, as well as people who are receiving their insurance through plans that are protected through the ERISA. So the health security plan, as far as what the benefits would be very comprehensive benefits, at least as comprehensive as what is currently provided by for our state employees. So that includes your traditional medical, inpatient, outpatient, but also some alternative medicines such as acupuncture. The health security plan would be ran by a non-governmental, independent citizens commission that is geographically representative of New Mexico. So, and that's per the State Board of Education school districts. So this commission would, since it's geographically representative of the state, every area of the state, rural, urban, all has a say in how this plan is ran. There are many cost containment measures in this. Of course, administrative costs are the costs of administering healthcare would be simplified significantly. You essentially have one plan of which you're billing through, so all the healthcare facilities and doctors' offices wouldn't need the support, as much of the support staff that they have for processing claims, for figuring out prior authorizations and what's covered by the multitude of different insurance companies. And then as well, there's other measures such as the bulk purchasing of pharmaceuticals. As we know, the cost of prescription drugs are skyrocketing, so there's measures to help contain those costs. And related to that, the financial or fiscal responsibility that comes with the plan, if this Health Security Act passes during the New Mexico legislative session this year, the first phase is actually to do a fiscal analysis of the plan. So it would assess how much is the plan going to cost, where is the funding going to come from, and what are the potential savings. It's worth noting that there's actually been 2 previous studies done on a plan such as this, one in 1994 and one in 2007. So they're a little old, and we're going to redo this if it passes. But the 2007 study that was done, it's worth noting that this plan has the potential to save New Mexico hundreds of millions of dollars. And thus that funding can be reinvested back into New Mexico, can save families and individuals a significant amount that they're spending on healthcare.
Okay, and so folks who are watching the show who hear that and are probably looking forward to another fiscal analysis to see where this stands, many people may say, this is not surprising to me, because as you pointed out, you gave just one example of the issue that we all face when we see with the red tape involved at doctors' offices, because they're dealing with this multitude of different forms and different health insurance companies, different health plans, HMOs and PPOs and all of this stuff. That's just, of course, one example. The biggest second one that of course must be mentioned is that with a single payer plan, part of the administrative savings is that there are no profits. Okay, we have a healthcare industry, which means that part of the expense is not for healthcare, up to 20%, and that was only under the Affordable Care Act, where that 20% cap was put in. 20% can go to administrative expense, and part of that is profit. So very quickly, I want to give some numbers, because this really may stun you. It really might. It certainly did me. A study in 2017 from the federal government that looked at this very question of administrative costs found that in Medicare, as an example, administrative costs in Medicare, 2016 was the year they looked at, were 1.4%, $9.2 billion. Sounds like a lot of money, and it is, but there was a system there, a Medicare system, that was over $678 billion. So it's 1.4% in 2016 for administrative costs. For private insurance, we have a study that was done by the Congressional Budget Office in 2016, same year. And here's what they found. Administrative costs in private insurance, 20% for non-group, 16% for small group, and 11% administrative cost for large group. So best case scenario, when you compare private insurance and a public single payer plan, we're talking about administrative cost, best case scenario, an average of 10 times as much money going to administrative costs, not to healthcare, not to the services that so many people need. Colin, we have a system for low-income residents, Medicaid, that, as I mentioned, was expanded in some states, including New Mexico, under the Affordable Care Act. So we have more people who are being insured. We have less uncompensated care, which it's often overlooked that, in fact, this is a major issue for all of us who have private insurance right now, that we have no choice but to have private insurance because we don't have a public option, because that raises the cost, uncompensated care of private insurance, and raises the cost for everyone as a society, for people who delay care to the emergency room when it's most expensive. You are advocating for a plan, Health Action New Mexico, that's before the state legislature, that would allow folks who didn't qualify for subsidies under the Affordable Care Act to, in New Mexico, be able to buy into Medicaid. Tell us about this idea.
Right. So I think you pointed out correctly that the Medicaid expansion has been an incredible boon for our state. It has brought millions of dollars, in fact, billions of dollars into our state economy and reduced that uncompensated care rate. But despite the successes of the Affordable Care Act, there are so many folks who still aren't able to afford health insurance. And that means that they're not able to manage their health conditions, they're not able to fill the prescriptions that they need, and eventually they have to resort to using the emergency room when their conditions have spiraled out of control. And that puts a strain on the whole system. And so Medicaid buy-in is a simple idea that if you're uninsured and you don't have another affordable option, you can actually purchase Medicaid coverage that covers an essential range of health benefits that gives you access to the doctors that you need to manage your conditions and make sure that you have access to care throughout the year. And if folks are willing to pay their fair share, then they should be able to get the care that they need.
And correct me if I'm wrong, so the plan that you're putting forward before the state legislature would be like a sliding scale for folks, right? So that if there are folks that have a higher income but still qualify, they would pay more. But if you have a very low income, let's say you're very close to that cutoff with the Affordable Care Act subsidies, you would pay less.
Right, exactly. Because as much as we might be able to leverage the Medicaid program to reduce the cost of the plan, for some families it's still not going to be totally affordable. And so by adjusting those costs, both out of pocket and premiums based on income, we can make sure that the coverage really is affordable for folks.
You mentioned something else, Colin, that I think gets often overlooked in this discussion, that in addition to, most importantly, providing coverage for people and trying to make it more affordable, that this is, many would argue, an essential and incredibly beneficial economic development program. That when you have good healthcare services, you are bringing more money into the state. In the case of the Medicaid expansion, many millions of dollars that came in from the federal government that helps pay for that Medicaid expansion. But we also have this rapidly aging population, and some studies show New Mexico in the future will be one of the states with the highest percentage of seniors in the country. And so there are more people, when they're making decisions about retirement or where to stay, in the case of folks who already live in New Mexico, stay in retirement, healthcare is part of that equation, right?
Oh, yeah, it's essential. I mean, as you're getting older, you're more likely to develop conditions that need to be managed and that you need to have regular access to care for. And so by investing in health coverage, which is the access point of our healthcare system, we can make sure that doctors are getting paid for the services that they're providing, and that there's that level of support that's there that's needed to treat those conditions. And for a lot of folks right now, that's just not the case, and especially if they're near retirement age and they don't quite qualify for Medicare, the premiums for private insurance can just be massively expensive, and often folks will have to go without health insurance. So by offering a new option that's going to be more affordable for those folks, we can ensure that they're getting taken care of, that they're seeing their doctors, that they have the care that they need.
Okay, thanks, Colin. Coming up, we're going to hear questions from our studio audience. But first, more on the importance of universal health coverage. Without it, our system often struggles, and lately some local facilities have the added job of providing services for an influx of migrants, some of whom need emergency care. In depth, Mallory Falk visited a Silver City hospital, which is one of the facilities that's provided care to migrants who have recently crossed the border.
Gila Regional Medical Center is a small county-owned hospital with 68 beds. It's generally pretty quiet here, or it was until last October. Border Patrol agents started showing up at the emergency room, escorting migrants in need of medical care, about a dozen at a time.
In my mind, I knew something had changed because you really have to go out of your way to come up here to Silver City.
Peggy White is chief nursing officer at the medical center, which is located about 140 miles from the border.
The other hospitals are down there on I-10 and they're at easier access. And so to see two large groups come up here, it was a key that something had changed.
With new restrictions on asylum seekers entering the U.S., an increasing number of migrants are bypassing large ports of entry. Instead, they're crossing the border in remote southwest New Mexico, turning themselves in at the tiny Antelope Wells port of entry, or small isolated Border Patrol stations.
Before this specific policy, we did have people crossing in very isolated places, but they were not asylum seekers.
Fernando Garcia is with the Border Network for Human Rights, an El Paso-based advocacy group. He says back then it was more common for people to cross the border there, hoping to go undetected.
We had seen now, since then, massive crossings in the middle of the deserts. I mean, we're talking about 150 to 100 people crossing at a time to turn themselves into the Border Patrol.
Most are parents and children, and some need medical attention, especially for exhaustion, dehydration, and during cold spells, exposure. So hospitals across the region are navigating a new challenge, treating an influx of patients who are also in government custody. Again, here's Peggy White.
If you'd have asked me a year ago how we would handle 15 people coming in all at once, it would have been sheer panic.
But her hospital has come up with strategies to quickly process and treat patients. After immigration officials showed up at the hospital unannounced twice, CEO Taffy Arias arranged a meeting with Border Patrol
to discuss what their process is and what their expectations are, and to let them know what our expectations were.
Now agents give the hospital a heads up before they arrive. Ideally an hour's lead time, but cell service can be spotty on the long journey to Silver City, so occasionally it's more like 15 minutes.
The relationships that we have now with the immigration authorities and letting us know ahead of time that they're bringing them in, we have enough lead time that we can, assemble the resources needed to take care of these patients.
Peggy White says her team had to think through several issues, like what to do with patients' medical records.
Records belong to the patient, no matter who they are. They belong to the patient. And so we can't just hand them off to anybody. And so it's the little details like that that always come back to complicate things.
The hospital gives each patient a copy of their medical records in their native language, then seals a second copy in an envelope for their healthcare providers back at Border Patrol facilities. Meanwhile, immigration officials have become a familiar sight in the hospital. They have to accompany the migrants, but can't be in the room during medical screenings or treatments. The medical center will be reimbursed for this care by Immigration and Customs Enforcement. The agency spends more than $250 million on detainee health care each year, according to a spokesperson. For now, Taffy Arias says her hospital is well equipped to take in migrant patients.
Getting 15 patients at once is always a little bit taxing, but we have the capability of taking care of even more than that.
But some medical providers are feeling more of a strain. Searchlight New Mexico reports Hidalgo County Emergency Medical Services is struggling to meet these new demands. The county manager sent out an urgent request for more resources. In the meantime, Gila Regional Medical Center recently hosted a consortium for healthcare providers and government agencies in the region to figure out best practices for treating detained migrants. Again, here's Taffy Arias.
We don't judge our care based on any political stance. It is immaterial to us. What is important to us is every patient that comes through our doors is important.
Arias views her obligation to these patients as both legal and moral. For KRWG Public Media, I'm Mallory Falk.
Another reminder of the need to constantly improve the capacity for healthcare services in New Mexico, from Mallory Falk. Thank you so much, Mallory. For the rest of our hour, we are going to be taking questions from our studio audience, and we're going to ask them to say their first name and the city where they're from. Thank you.
My name is Cindy Merle. I'm with the League of Women Voters of Greater Las Cruces. And I'm the daughter of a dentist who has done quite a bit of volunteer work overseas and in New Mexico with impoverished people. And because of that, I know that dentistry is not just about pretty smiles, that can have systemic effects on a person's health and also severely impact their quality of life or ability to work. And yet, the people I know who are my age and older have no dental insurance and no way to pay thousands of dollars it might take to replace a tooth. So my question, mainly for Davina, is, will there be a study of covering dental health in this Health Security Act?
Excellent. Thank you very much for that question. And dental care is absolutely something that affects so much of our health. So initially, dental coverage is not included as one of the benefits, but the commission would be tasked with evaluating whether that can be included into the plan. So yes, there is the plan to evaluate how to add additional coverage such as dental and vision into the plan.
You know, I wasn't expecting this particular question today, but it is a very good one, and one that, again, like so many things in healthcare, is often overlooked. I worked for nearly a decade in Michigan prior to moving to New Mexico in 2008 when I moved here. And shortly before I moved here, Michigan added dental care back to its Medicaid program. It had been taken away, and Michigan did a study and found out that the Medicaid system was actually paying out more money by that decision because people were, as you might imagine, going to the emergency room for a toothache because they no longer had dental insurance under Medicaid. Thoughts on this, Colin, under Medicaid in New Mexico and elsewhere, by the way?
Yeah, it's a critical benefit, and we always say at Health Action New Mexico that we have somehow removed our head from our body when we talk about healthcare. We've neglected behavioral health coverage for a long time. We're finally getting some parity on that. Of course, our mouths, our ears, and our eyes, we often don't have health coverage for. And so that's critical. And I think it's great that the Health Security Act is going to be looking at that. In some of the studies that we've done, we looked at the cost of adding a dental benefit to the plan, and I think that it winds up paying itself off down the road because we're realizing how important oral health is to our overall health. And if we, again, treat those problems before they become emergencies, before people wind up in the ER, it means better quality of life, and it means fewer costs down the road.
Sure, and of course the connection to other health issues that may be caused when people don't get proper dental care. Another question.
My name is Alex, and I'm a health plan user. The plans that have been discussed here, they sound very good and cost effective. Who is opposing them? How are they opposing it, and why?
Okay, and so this may be different depending on the plan. Let's start with the idea of the Health Security Act for single payer for New Mexico. Who's fighting this?
So, well, First, if you don't mind, I want to mention who has been supportive of the health security plan, and then I'll talk about who wasn't. And so actually the health security plan has the largest coalition of organizations supporting it. Nearly 200 organizations have signed on as endorsing it. And recently that included some of the medical society, so the New Mexico Medical Society and the New Mexico Academy of Family Physicians. 36 cities and municipalities and county governments have also passed resolutions in support of the health security plan, including our own Doña Ana County Commission that reaffirmed their support last week. So as far as the opposition, I had the opportunity to be present during the House Health and Human Services Committee hearing at the legislature a couple weeks ago. There were over 35 who spoke in support and 2 in opposition, and they were lobbyists associated with the health insurance industry. So as far as opposition, I think our big opposition, of course, is the health insurance industry, whom would be switched to a supplementary role with the health security plan.
Okay. How about you, Colin? Are there opponents to allowing people to buy into Medicaid?
Yeah, and you know, I think I'll use your play to say a lot of folks have been incredibly supportive of the Medicaid buy-in as well. An amazing coalition of grassroots organizations and families throughout the state who have thrown their support behind the Medicaid buy-in. And I think we're hearing similar things from the opposition. Some of the folks in the insurance industry have voiced opposition, and we have heard from some providers who have concerns about Medicaid reimbursement rates. And that's why, as part of the plan, we really focus on those folks who are uninsured right now, who otherwise would be on compensated care for those providers. And if we can get those folks into the system now, and then study the reimbursement rates and see how we can get those up to a level of adequacy for all of our providers in the state, not just for the buy-in, but for the entire Medicaid program, then that will strengthen our entire healthcare system. And so we're taking those concerns seriously, and we feel like we've addressed them in the bill. Okay, very important information. And for folks watching at home, there's a great website, followthemoney.org. You will see that healthcare spends a lot of money on lobbying against plans like this, lobbying for things that really add costs to the system. One that relates to this very idea of improving coverage for folks that has been widely scorned for a very long time and is the result of lobbying, is the Medicare Part D prescription benefit. When that was passed under the George W. Bush administration, there was great lobbying by the pharmaceutical industry to make sure that the government could not use that enormous buying power under Medicare Part D to prevent the government from using that buying power to negotiate for lower drug prices. So do some research on this online. It comes up very quickly. You'll see that the same medication, when purchased by the VA, is enormously cheaper than when purchased by Medicare Part D. So, of course, it depends on the drug, but this is, again, an effect of having a healthcare industry as opposed to a healthcare system. Another question?
That's precisely the point I was going to make. I'm Tom Hansen. I'm a recently retired physician, and for 45 years I was an endocrinologist. Just earlier this millennia, the price of analog insulins increased by 300%. And it's appalling that patients who have to have insulin can't afford it. And it's the very issue that you just described. Medicare didn't make a provision for negotiating drug prices. How at the level of the state are we going to be able to overcome that defect? Thank you.
This is interesting. Thoughts on this?
Excellent question. I appreciate that. And I'm actually a pharmacist who works here in Las Cruces, and I see on a daily basis the impact of the skyrocketing costs of prescription drugs have had. And And so I really appreciate that question. The New Mexico Health Security Plan includes the bulk purchasing of pharmaceuticals. So you take an estimated 1.7 million New Mexicans that would be enrolled in the health security plan, and that would create a fairly significant purchasing power to help lower the cost of prescription drugs in the state of New Mexico.
So your plan doesn't reflect what I just mentioned in Medicare D, which actually prevents the government from negotiating for better prices. Yours encourages it, requires it.
Absolutely.
Okay, Vicki.
Yes, I think that Senator Jeff Steinborn is sponsoring a bill in the legislature that would enable New Mexico, you two probably know more about it.
Mm-hmm.
Yeah.
Yeah, it creates an interagency drug purchasing council. And so there are a lot of different state agencies that are buying medications right now. And if they were to coordinate their efforts more, this bill would let them do that and actually maximize that purchasing power to drive down the cost of prescription medications. Now, that would really, help the state budget. And the way that we see the Medicaid buy-in fitting into this is, it being built on Medicaid allows it to tap into that broader system, and by bringing more people into it, actually increase that purchasing power of the state. And so it's just one of many ways that I think we can get at this issue, but we commend Senator Steinborn for the great work he has done advancing that bill.
Thank you for that. Another question?
Yes, my name is Kim. By the time a child reaches the end of their 5th year of life, 90% of their brain growth is completed. Healthcare and nutrition during the first 5 years have a profound effect on that process, setting the stage for either good or poor outcomes when the child enters school. Across the state of New Mexico, over 30% of our children come from families in severe poverty, and they often do not have healthcare or good nutrition. My question is, what have the advocates for the New Mexico Health Security Act done to create awareness with New Mexico legislators and the public about the need for health care for all of our children in order to have a better future workforce, economy, and good life for our children here in New Mexico?
Okay. Davina.
Excellent. Thank you for that question. And the New Mexico Health Security Campaign, as I mentioned earlier, has nearly 200 different organizations that have signed on to the coalition and really have been at the grassroots level to communicate with legislators. I think that question gets at the interconnectivity of all of these issues, from the importance that having access to health care does for ensuring appropriate development of children, and even the connection to education and environmental issues. And so the campaign, with its grassroots advocacy, of course, are considering all ages and the importance of ensuring access to our most vulnerable populations.
Okay, very, very important issue, and I wish we had 2 hours for this program because there have been so many great points that have been brought up already. We have another one Dale is here from the League. Hi, Dale.
Hi, I'm Dale from the League of Women Voters of Greater Las Cruces. The League has been trying to follow the progress of various health bills in this legislative session. And I looked through the bills and found that there are almost like 100 health bills in the Senate and 50 in the House. I'm wondering if you would like to bring out information about any of these other bills other than what you've already mentioned that you think are important.
Okay. Anybody want to take that one? I mean, there may be things that are certainly, as you've already mentioned, complementary to the health security bill and also Medicaid buy-in.
Sure, I don't know if you want to. Sure. So there are a lot of important healthcare bills this year. One of them that we are really focused on is House Bill 436, which is sponsored by Representative Liz Thompson, and it would add the pre-existing condition protections from the Affordable Care Act into state law. And that's because we're seeing that there are still threats to those protections. There's a lawsuit that's making its way through the courts right now that is seeking to repeal the entire Affordable Care Act, but what's especially troubling is that the Trump administration's Department of Justice is specifically declining to defend the pre-existing condition protections. And so to plan for the worst case scenario, we are advocating for those protections to be put into state law. That's going to be critical. Another bill is House Bill 285, which is sponsored by Representative Micaela Cadena, and that bill will help to regulate some plans that the Trump administration has been advancing in recent years. So they're called short-term plans, and originally they were supposed to just cover transitions in coverage if you're between jobs or something like that, but these plans don't have to comply with any of those pre-existing condition protections. So what they're doing is coming up with these plans that have enormous deductibles, that reject people who do have health conditions, and basically try to bring all of the young and healthy people into those plans, and they raise costs on everybody else while not actually providing any sort of protection for those patients. So that's another one that's going to be critical. And then finally, House Bill 308, which is sponsored by Representative Doreen Gallegos and Representative Gail Armstrong, would create a new mid-level dental care provider called a dental therapist. And the dental therapist can do a little bit more than what a hygienist can do, but less than a dentist, and could be out in the communities serving under off-site supervision of a dentist, and really meet that critical need that was mentioned of dental care, especially in rural and tribal communities. They would be able to provide preventive services along with some of the basic restorative services like being able to drill and fill cavities. Okay. So all of those would do an incredible job of making sure that patients are protected in New Mexico.
Davina, anything you wanted to add on that? Other bills?
Well, he hit on two that I was going to mention, and one of them specifically was the protections for people with pre-existing conditions. It is very important to add that protection at the state level in case there are threats to the Affordable Care Act, which repeal that.
Yeah. You mentioned earlier, Davina, that you are a pharmacist. You work in healthcare for a living. So it's a good time, because we don't have an audience question right now, for me to ask you about one of the things that you face in your job. I know you face this in your job, because as a health consumer, I have faced this. And it's one of those seminal moments in my life, learning about healthcare from a personal situation, and being stunned that when my biggest expense is paying for healthcare premiums to a private for-profit company, I went to the pharmacist for a drug prescribed by a doctor, by the expert, and was told at the pharmacy counter, your insurance won't pay for this. We need to call your doctor, and we need to find an alternative, a lesser drug, because it's cheaper. You deal with this all the time, don't you?
All the time. Absolutely.
Yeah.
And it's probably one of our bigger frustrations. So I work in an inpatient setting, and I work with a team to care for people in the hospital and then also prepare for discharge. And it's really not uncommon that we have people leave the hospital to get to their pharmacy and discover that their new medication is not covered or preferred by their insurance. And common ones, basal insulin, a blood thinning medicine to treat blood clots. And so this can contribute and lead to significant harm. And something that's frustrating, and I acknowledge that to contain costs, there needs to be drug formularies, absolutely. But with the multitude of payers and insurers that we have, trying to predict which drug is covered by which insurance is a nightmare. So we've tried to, when we're preparing for discharge, we try to be proactive, figure out what insurance somebody has, try to find their formulary online and figure out what is their preferred medicine in that class. But that takes a lot of time that, quite honestly, I could be spending doing education or something that is more beneficial to a person's care. So.
I imagine this must be, in your job, one of the most frustrating things. I've been at the pharmacy counter when I've seen other folks not react very well and essentially take it out on the pharmacist for something that the pharmacist has nothing to do with this.
Yeah.
I mean, it's it's particularly ironic, isn't it? Because when we think back to the Affordable Care Act, one of the biggest oppositions that came out to the Affordable Care Act was this notion that if we pass the Affordable Care Act and we have essentially more government involvement in healthcare, that somehow this is going to make care worse, or this is going to put you at a situation where instead of your doctor making a decision, the government will. When in fact, the biggest example of that is what we have now, where decisions are made on the profits, that we want to maximize profit. It isn't about maximizing healthcare, right?
Absolutely. Yeah.
I mean, this is really important, and it's something that when we talk about the larger issue of healthcare, I think one of the reasons perhaps this is not as well understood as it could be is because until it happens to you, until you are in this situation, and you see it personally, you may not realize just how prevalent this is. But you working in this field, you see it, I guess, about every day, right?
Every day, yeah.
Every
absolutely.
single day.
And to add on to that, something else is that they also determine which doctor you go see, which pharmacy you fill your medications at. This hit very close to home for myself personally. I have insurance through my work, and my prescription coverage is CVS Caremark. So if I want to go to X pharmacy in town because I trust that pharmacist and want to fill my medication at that pharmacy, they will not pay for it unless I go through CVS or CVS mail order.
Okay.
So they're determining which pharmacist I go to.
Yeah.
The New Mexico Health Security Plan eliminates that. There's no more networks. You have freedom of choice of your provider, of your pharmacist, including across state lines.
And how about that? It increases competition.
Right.
Which is another argument that comes out for what we have now, is that somehow we have competition. When we don't have competition, you're actually forced. You don't have a choice. You can't generate competition. You have to go to the CVS Caremark system.
Right.
Fascinating. I think we have time for one more question. Hi.
I am Marjorie, and I'm from the League of Women Voters, and I have a bottom line question. We have still a large percentage of our people who are uninsured in New Mexico. It's not as large as Texas, but then that's a low bar. The three plans that we have heard about, can each of you tell me how that would affect the number of uninsured in New Mexico? Vicki, I'm hoping that you will talk about expanded Medicare.
Okay, so we have just a few minutes. Vicki, we'll start with you because the League, as you mentioned at the beginning of the program, advocates for nationally and in New Mexico the idea of single-payer health care. This is a universal system, so everyone would be covered, right?
Right.
Yeah, so that's very important. Now, with the Health Security Act, that's the idea, but just for New Mexico residents. But you mentioned earlier that there are some exemptions, so.
Yeah, that is correct. So it would eliminate uninsured numbers in New Mexico. The health security plan would ensure that all New Mexicans have coverage. The few that I mentioned, the groups that are excluded, they already have their own coverage through their military retiree, federal retiree, et cetera. So the health security plan would eliminate the concern for uninsured people.
Okay.
And because it doesn't cover all groups, it's not referred to as single payer.
Okay, got it. Okay, so Colin, if folks are allowed to buy into Medicaid, what are the predictions on reducing the percentage of uninsured in New Mexico?
So, this is going to take a few years to be in place. We're hoping that by the end of 2020, the plan is going to be offered. And so there are going to be about 80,000 people who are eligible for the plan once it's up and running. And of those, we're hoping that in the first year, we can reach about 25,000 of those people. And with some focused outreach on those communities that aren't covered right now, we can get that number as high as we possibly can. Now, there are still other folks who wouldn't be eligible for this program that might be eligible for some other programs, including folks who might be eligible for Medicaid right now who are still uninsured. We need to reach those folks when we're doing our outreach, and we need to reach those folks who might be eligible for financial assistance on the exchange. And if we can have a focused effort that's really going into the communities, talking to people, rebuilding trust in state government, then I think that we can get close to universal coverage in the next few years.
And Colin, we haven't talked about this yet, but in our remaining minutes here, the plan that is before the legislature now, as I understand it, to help make Medicaid, if Medicaid buy-in is approved by the legislature, to help make it more affordable for folks, there would be a state subsidy for the system, right?
Right, and that's how we're able to adjust those premiums based on income. We've also included in the bill the ability to seek federal waivers to provide some of that assistance, but we've designed the plan in a way that's really meant to address the current reality. Right now, those waivers probably aren't going to be available through the federal administration that we have now. So what we've done is designed a plan that New Mexico doesn't need to go ask for permission from the federal government. We can get this plan up and running now and then find those savings in the following years.
Okay. Absolutely critical information for people as they watch the legislature in Santa Fe, and then beyond the legislative session. We hope to have both of you back in our studio to talk about the results, what happened, and where it goes from here. Colin, Davina, Vicki, thank you all for being with us today.
Thank you so much.
Thank you.
Thank you at home as well for joining us for this program. You are the reason that we are here today. Your input in the studio audience, your contributions to public media, your comments to us on a regular basis about the importance of in-depth journalism, of covering issues that matter and avoiding the talk that often happens, which is really just about politics and doesn't get to facts and in-depth information. You're the reason we're able to provide this service, and we appreciate it very much. Continue the dialogue with us. Always send us your ideas to feedback@nmsu.edu. And for all of us at KRWG News, I'm Fred Martino. Thanks so much for being with us. Have a good week.